Panning the room. Hi, I'm Lisa. I'm going to do my trach suction and trach care video all in one. I'm in the room. I've provided privacy. I've verified the order. I have identified my patient with 2 identifiers, checked for allergies, checked for pain, listened to his lungs, and there is some wheezing in there. Got my suction turned on, and it is working, and I've got it set to where it's just under 150. If my patient was a child, I'd have it set at 120, no more than 125. For an infant, it'd be no more than 100, and for a neonate, it would be no more than 80. And I've explained everything to the patient. They've had the trach a while, so they're used to what's going on. Are you ready, Mr. Bailey? All right, I'm gonna put a drape over you. Keep you clean. All right. Sterile water in here. Section's still working. Connect them together. All right, Mr. Bailey, you ready for this? All right. Need to take a couple good deep breaths. All right, you ready? I'm gonna remove your oxygen. I'm gonna insert the suction catheter. Don't want to go down any farther than about a centimeter or so below the tube. And then I'm going to suction out about 5-10 seconds at a time as I pull the suction tube out. Let me apply the oxygen for him to catch his breath. And I would do this for up to 3 times if needed. Once I'm done with that, I would suction with the water that I suction up some of the water each time I would suction him out. Suction it out one last time. Suction out his mouth as needed. And reassess his lungs, make sure that they are still good. And clean up my mess, and I would report and record. And now I'm going to go ahead and finish with my trach care. I've still have that on, his oxygen on there. All right, I'm going to remove this suction tubing. All right, I'm going to wrap it up in my hand and throw my gloves away. sterile kit. Hand hygiene. If I didn't mention it earlier, I do have my mask and goggles on. And put my sterile water in here, as I'm going to need it in just a second. Take a good deep breath, and we're gonna put this back, put the new trach back in here. All right. Make sure that clicks in there good. All right. Two back down on here. I'm going to remove this old pad. And clean around the trach. And then I'm going to pat dry. And replace the pad under his trach. All right, now I need to replace his collar, and if there was another nurse available, I'd have them come in and help me. But since I'm by myself, then I will adjust one side, insert one side in here, and then insert the other side and remove the old collar. Undo the old collar, take it off. I listened to his lungs, make sure that his lung fields were still all clear. Put him back down in comfortable position. Lower the bed down. Clean the rest of my mess up and report and record. And come back and check on him in a little bit.